loving and hateful beings on earth. And we've come to have a significant effect, good or bad, on everything we touch. I'm Thane Maynard. Tune into the 90-Second Naturalist and find out how we're interacting with the natural world today.
Listen every weekday afternoon during the KSJE Evening News at 5:30.
Hi, I'm Yael Cassander.
And I'm Don Glass.
And we host A Moment of Science.
For more than 20 years, A Moment of Science has been taking an entertaining look at the science behind some of life's most perplexing questions.
In just 2 minutes, you get a look at the fascinating world around us and beyond.
We hope you'll tune in.
For more information about A Moment of Science or to download our latest podcasts, visit us at amomentofscience.org.
Listen weekday afternoons at 5:45 on KSJE. KSJE is supported by San Juan Regional Medical Center, your community hospital with a rich heritage that dates back to before New Mexico was a state. We've been improving the health of the Four Corners since 1910. As a nonprofit hospital, San Juan Regional Medical Center is a values-driven organization. We strive to deliver on our mission to personalize health care and create vitality and enthusiasm in healing. We are here for you when you need us, offering a comprehensive range of inpatient, outpatient, and emergency care services. (8:34) Wednesday morning on KSJE. You're listening to the Scott Michlin Morning Program. Good morning, everyone. Thank you for tuning in, and good morning to our viewers who are watching us live this morning on the KSJE Facebook page and YouTube channel. We are showing you pictures from beautiful and snowy downtown Telluride, Colorado, where it is currently 28 degrees and snowing. And that is the situation up in Durango as well. In fact, the Durango camera is completely blocked out by the snow this morning, so we can't show you a picture up on the mountain from Durango, but this is the picture a little bit closer to the ground in Telluride. Our forecast calls for, well, a snowy day here as well. We're expecting our scattered showers to switch over to snow later on today. The high in Farmington only about 41 degrees. Overnight low tonight 30, and there is a wind advisory in effect here until 6 p.m., so it's going to be wet, windy, and wild on this Wednesday for at least alliteration purposes anyway. Tomorrow, clearing should start, though, with partly sunny skies on Thursday, the high 43. Warmer still on Friday with a high of 47 and the lower 50s by Saturday, and mid-50s with mostly sunny skies on Sunday. Overnight lows are clear and cold, mid-20s overnight on Thursday night to mid-30s on Sunday night. Again, I'm Scott Michlin. My guest here on the radio from San Juan Regional Medical Center, where we're talking about Patient Safety Week this week. Joining me here in our studio again, Suzanne Smith is here. She is the Chief Nursing Officer at the hospital. Good morning once again.
Good morning to you.
Thank you for being here. Also, Cindy Byes is here. She is the Director of Clinical Services. Good morning to you.
Morning.
Thank you for being here. And also, Cynthia Brandt is here, Director of Laboratory Services. Good morning to you.
Good morning, Scott.
A full studio this morning. We're using all of our cameras here, which is very exciting. So thank you all for being here to talk with me about this Patient Safety Week, which is so very important. And as we've been talking, it's all about keeping patients safe when they come to the hospital, whether they are, whether they're a patient or a visitor, or it doesn't matter who. Safety pertains to everybody, right?
Well, safety applies to everybody. So patients, their families, visitors. There are a lot of outpatient services that occur at the hospital. So a lot of people who are, coming in just for very brief periods of time to have testing done, and then also our employees. Certainly not the least of which we value their safety also.
Very true. Very true. We were talking during the break a little bit about safety advocates, and so talk to me a little bit about what those people are.
So we have what we call Safety Advocate Program, and it's not a temporary thing. Once you become a safety advocate, you really are making a commitment, we hope, for your lifetime. Mm-hmm. And so it really is a focus on not just the tools that we utilize for safety adherence, but also really to garner some enthusiasm and some confidence to be able to speak to things. So like if you see something unusual happening, to really have the temerity to say, I see this and I'm going to stop the line. I'm going to intervene. I'm going to warn. I'm going to call it out so that I can help stop that. And so really we work with people to increase their confidence so that they have that ability to speak out and to be comfortable and confident. So we do a program of probably about 30, I think there's probably 30 people in each class, we call it, and spend a whole year with them really working on these different tools and gaining that skill set. And then we have a little bit of a graduation and celebrate their successes, and then we bring in a new group of people. And so really it's a role that you take on forever.
Interesting. And the whole idea, too, I think, at the hospital is to empower all of your employees if they see something that could potentially cause a problem or be a problem, to speak out or tell somebody, as you mentioned, stop the line. So you kind of, if there's a procedure going on, you have the power to maybe stop that as we take a second look at it? Yeah,
absolutely. And we want people to feel empowered to really make a difference. And there's in all work environments, there's going to be essentially a chain of command. But we want the individual at any level of employment to feel comfortable and confident that if they see something that they know is wrong, again, to be attentive to that detail, and if they see something that is wrong, that they feel confident that they can say something, that they can stop something, so that we don't, and it doesn't matter if it's to a physician or to myself, somebody on the senior leader team, we really want people to feel comfortable being able to speak out.
And that's somewhat unique, I think. It doesn't happen in every workplace.
I don't think it does happen in every industry and stuff, but I think that the responsibility that lies with healthcare is one of, it's great. We have the responsibility to help people, to do no harm.
Right.
And so if we don't all take part in it, then it is not as likely to succeed.
Sure. And let me ask our other guests about that same thing. Cindy, same type of thing. I mean, is that empowering for folks in your area to be able to go up to someone maybe at a higher level at the hospital and say, if they truly believe something's wrong, to say, hey, we should probably think about this or take a look at some stuff?
Yes. For example, if a nurse is in a patient room and they're supposed to be washing their hands, hand hygiene,
right,
in and out, maybe a housekeeper or a nursing assistant notice that they didn't, they can stop them and say, I noticed that you did not wash your hands when you exited the room. We want to make sure our patients are safe, so that nurse that goes possibly to the next patient room may have contaminated hands. So, yes, at every level.
It's important.
It's important. So.
Right. Okay. And Cynthia, same question, I think, to you in your area, same type of thing, where someone can come up to you and say, hey, I don't think this is right, or I don't think we missed a step, or something, we might double check something?
Right. For us, especially with our phlebotomists and our processors of specimens, we have to be sure that our hand hygiene is excellent, that when we come in, we properly identify the patients. We don't turn out wrong test results on wrong patients. They don't receive incorrect results, incorrect treatment, incorrect diagnosis. It's just so important, and it's the very first step for us to be sure that the patient is safe and that we come in and we treat them safely.
I suppose in your line of work, if a sample gets contaminated or there's a problem, it could lead to other, if it's not caught, it could lead to other issues down the line.
If a specimen is contaminated, the results are absolutely inaccurate, and it can lead to incorrect diagnosis, incorrect treatment, incorrect amount of treatment. So it's very important, and we treat these people's, the phlebotomists, the processors, the assistants, what they say is very important to the technologists and to myself as we work.
Sure.
So very, very important.
So good policy to stop it before it starts.
Absolutely.
And for all of you, I can see that. So very interesting. Safety huddles, I want to ask you a bit about that. Sounds like you're on a football team.
It does sound like a football, and maybe it is a little bit like that.
Right.
So we have safety huddles at truthfully, every level within the organization. So departments start their day with a safety huddle. So that would be, say, a nursing unit at shift change when you do the handoff. And we do our handoff at the bedside. And that is an expectation because you are including then the patient in that discussion. This care is about the patient. It's about their well-being, their their goals for the day. And so it does provide then an opportunity for the patient to communicate information that they maybe hadn't shared, or for them to ask questions of the staff. So we do our handoff at the bedside, and then the nurses have, at the start of their shift, they gather up and they talk about things that might be of, sort of high priority, if you will. Maybe there's a patient who's been identified as being someone who's at high risk for a fall. Maybe that's someone who's confused or agitated, and so that then everybody is alert to that. So that patient is not is truly assigned to the care for one nurse, but really that patient's everyone's responsibility. And so then everybody is familiar on that unit and is as particularly attentive to that information. Even in the housekeeping department, they have a morning huddle or an evening huddle, shift change huddle,
right.
And they talk about the things that they need to focus on for their day. So it really gets people started, sort of sets up your day with a positive start.
And I suppose if someone is maybe agitated or easily confused or something, it's maybe good for your staff to know that before even going into the room, of what to expect or how to maybe approach that patient, because it may be a totally different way that you would do that as opposed to someone who's maybe completely aware of where they are and what's going on and what's happening, kind of a thing.
Well, I think really, the nursing staff, phlebotomy staff, housekeeping staff, anybody who's in that patient's room really needs to be aware, because everybody has the power to interact with that patient, to calm them down, to be gracious and to be friendly. And those things really do help calm a person down. But a highly agitated patient does, pose a risk to themselves for falling.
Sure.
For falling, they absolutely do. So yes, being aware absolutely makes all the difference.
Makes sense. And we've talked a lot this morning about how you talk to the patient, confirming information, names, social security numbers, and things like that, just to make sure that the double check of medication or treatments or what have you. My question would be, what if the patient is unable to answer those questions? Maybe they're unconscious or they're still getting treatment. Is there still another way to double check these types of things?
We, for the patient who's not communicative, and that might include children, small children, for instance, or individuals who are confused, we rely on a couple different factors. We rely on family for initial identification, and then we utilize photos. So in our pediatric department, for instance, we take a photograph of every small child, and we use that as a comparative, because if the parent is not there, and we welcome our parents to stay, but not everyone can stay.
Sure.
And we have to understand that. And so if a parent's not available, then we utilize that photograph as that identification comparative to assure the identity of any individual child.
Gotcha.
And the confused adult, or non-communicative adult.
That's what you can use in that case as well.
Yes, absolutely.
Interesting. My guest this morning from San Juan Regional Medical Center. This is Patient Safety Week all week long, and this is not just at your hospital. It's all over. It's all over the country, is it not?
Nationwide.
This is a nationwide observance, and of course, patient safety is something you deal with year-round. But this week specifically, you're focusing more attention, I guess, onto the programs and policies that you have in place to ensure patient safety.
I think we want to draw attention to it, not just internally, but most especially internally, just to remind people to acknowledge it and to celebrate it, but also really to communicate to the community at large that we value that and that we attend to those details on a routine basis.
Right. Very good. We just have a couple of minutes remaining this morning, everybody, but I know we were talking during the break a little bit about some services that people don't even have to get out of their car necessarily for if they come to the hospital. One, of course, is the very popular flu shots that you can drive to and just roll up your sleeve and roll down your window and boom, there you go, right?
Yeah, provide a little information, sign a consent form, and you can get a flu shot while you remain in your car.
Right.
Very popular.
It's like fast food, right? It's a drive-through flu shot.
Yes, that's a great connotation. Yes, it is like fast food.
Maybe a little healthier than fast food. We'll put it that way. But that's one way. But you were saying to me, too, that you do some take blood maybe from someone's car?
Yeah, Cynthia had shared a story with me where an individual patient who may not be as mobile and has a difficult time getting out of their car, and so her phlebotomist will come out of the ODC and they'll register that patient at their curb, and do their phlebotomy or draw their blood from their car, so the patient doesn't even have to get out of the car.
Interesting.
to assure their safety.
Cynthia, let me ask you a little bit about that, and that's something that is okay to do, I suppose.
It is,
right?
as long as you have your registration person and your phlebotomist that's using good safety techniques. So again, it's a culture of safety, a culture that we take care of our family, and safety first always.
And the issue is just that maybe that individual may not be able to safely walk into the
Exactly.
the office to have this done, and so it's easier for your staff to go out to them.
Absolutely.
Is kind of what you're talking about.
Absolutely.
But interesting. So that's just one more example, I suppose, right? And there was another thing we talked about during the break, which is it Houdini protocol? Am I remembering that correctly?
Yes.
And so, Cindy, talk to me a little bit about
Yes.
what that's all about.
So in order to reduce...
You make people disappear?
Not quite.
No. Okay. I didn't think it was
In
that. That's where
order
my
to
mind goes. See, so I'm glad you're here to set me straight.
In order to reduce catheter-associated urinary tract infections,
Right.
we have a Houdini protocol where a nurse completes an assessment, and if they no longer require that Foley catheter, the nurse can discontinue it without the physician order. So as soon as it's not needed, let's pull it out to reduce that risk of infection.
I see. I couldn't have been more wrong as to what I thought that was all about, right?
And
So-
Houdini actually stands for multiple things. It's the criteria.
Right.
H is for hematuria, and et cetera, hourly
It's an
output
acronym.
rate.
It's not the
Correct.
magician. I
Correct.
gotcha. See where I
Correct.
went
So-
with that? So I appreciate you being here to set me straight. But that's another easily remembered protocol, I suppose, right? When we're talking about things like that.
Yes.
So that's interesting. And that's just one more area of safety that you all are working on.
Correct.
So-
to reduce that harm, patient harm.
Right. Right. Very interesting. Okay. Well, thank you. Anything else we want to mention before we run out of time this morning, everybody, about Patient Safety Week and some of the things that we're talking about? Cindy?
One more
Yes.
thing that we do. This is not new. We have done bedside medication verification for a number of years, but with our new system, yes, we continue that. So when nurses go into the patient's room, they're making sure by scanning the patient's ID band and the medications, then we're assuring that the right medications are given to the right patient. So that's another level of safety.
I see. And that's important as well.
Yes.
And I know recently the hospital started up a new electronic health record system, and that has been kind of being implemented over the last few weeks or so. And
We went live January 19th.
January 9th, we did a show about it. I know, and that's true. And so, like any new system, it takes time to get used to it. But this idea was, as it was explained to me, it kind of combines a lot of older systems and older different
Yes.
platforms into one to make things a bit ideally easier for
Correct.
your staff to use. And so, is that
That's
proving to be the case?
Yes, it has. So our clinics have the same system, so we can see those medical records, ED, so you can see what happened in the office in the ED, all the way to
That's emergency department,
emergency
right?
department, intensive care unit, the unit, medical unit per se, and then maybe even then to our rehab hospital. So it's a continuum of care with that one medical record.
And the staff can see all those things and I guess make notes
Correct.
or kind of make additions or notations as to how the patient is doing or reacting to certain treatments or medications or what have you. And everybody can see all that in real time, I
Yes.
suppose, or pretty close to it.
Yes.
And that's a big change from what you had before.
Correct. You would have to go here or there or to see the different records from different entities.
Right. So a big change and
Yes.
improvement at the hospital. So
It is definitely a big improvement.
wonderful. Well, I can't thank you all enough about coming in this morning and talking with me about the importance of patient safety and visitor safety and just overall safety when we talk about healthcare these days. And it's something that I know is very important for patients and visitors at the hospital and your staff as well. It's something that apparently you live, breathe, and eat every day, sounds like to me.
Absolutely. Safety, we have what we call service standards, and safety is, of course, that very first one. And many people use it as their catch line, right?
Right.
Safety's job one. Well, it really is in healthcare. It has to be.
Yeah, very true. Well, thank you all very much. Thanks for coming in.
Thank you for inviting us.
You're very welcome. My guests here on KSJE from San Juan Regional Medical Center. We were talking about Patient Safety Week this week. And I'll be back with more in just a moment, everybody. The time right now is 8:52. This program on KSJE is supported by Citizens Trust and Investment Corporation, providing a competent, innovative, and caring team of professionals to serve wealth management, trust administration, employee benefit plans, retirement planning, and estate settlement needs. Find out more about Citizens Trust and Investment Corporation at 505-599-0181.
Brilliant, well-respected, but at times controversial, Alan Turing helped crack the German Enigma codes in World War II.
A Moment in Time with Dan Roberts.
After study at King's College, Cambridge, and Princeton, in a dazzling insight, almost a casual aside, in a footnote, Turing laid the theoretical foundation for the modern programmable computer. He described in theory that one might construct an automatic machine that, given the correct input, could do just about anything requiring computation. The device...
Health Minute from Dr. Ariel Leese.
Some people love the winter months, but for most of us, the lack of sunshine makes us moody. Many even experience seasonal affective disorder, or SAD, an onset of sadness due to the winter months. SAD occurs for reasons like lack of sunlight and changes in sleeping, eating, and exercise habits. Though feeling moody during the winter months can be frustrating, you're not doomed to depression just because the sun sets earlier each day. Consider these ways to combat the winter blues. Go big at breakfast. Structure your diet to where you're eating the most in the morning and less at night. What you eat has a profound effect on your mood, so shoot for lots of whole grains and healthy fatty acids. Stay on a regular sleep schedule. Getting enough sleep is a vital part of staving off depression. Go outside and exercise. Get outdoors in the sunshine and fresh air as much as possible. Finally, socialize. Isolating only worsens SAD, so spend time around friends and others so that you can tackle the oncoming holiday season and weather.
For questions or concerns about this Mental Health Minute, text 258-1029.
Wednesday morning here on KSJE, and it's time to take a trip to the Encouragement Lab. That's where Communications Professor Dr. Mike Hattabaugh is standing by. Good morning, Dr. Hattabaugh.
Good morning.
Thanks for being with us. And this starts a three-part series with you and me on authenticity today, right? Beginning this week.
Exactly, yeah. Authenticity. You know, authenticity is the new everything.
Is it? Okay.
Our culture has really, you know, with all the fakeness, we're just tired of, you know, fake models and, you know, photoshopping everything. And so we've become a culture now that we expect authenticity. So you need to learn how to be authentic, and you will be more well received by others. So that's what we want to talk about the next few weeks.
Interesting. Okay. And so today we're just starting with the topic of being real, right? So
right, which is kind of at the root of what authenticity is, right? It's just saying, look, I'm just going to be me all the time. What you see here on camera or listen to on the radio, that's who I am. I know you, Scott, well enough to know that you're the same guy on the radio that you are off the radio, and that's authenticity. And, you know, you're not some prima donna that, you know, has to, you know, be chauffeured around, and right? You don't do that.
Well, they wouldn't put that in my new contract, so you're right. I didn't get that. But yes, that's true.
But we did talk about where you park when it snows, but that's a whole different issue.
That is a whole different issue. That's true. Exactly. But right. And so that's got to be a little bit difficult in this day of social media and Facebook, and some people maybe try to present a certain image of themselves in social media, maybe more than they are really doing in person. Right.
Well, something like 70% of the people on, you know, these dating apps,
right?
70% of the profile pictures are not a picture of the person that's there, or at least it's one from 10 years ago. I was watching a doctor on YouTube, and I watched a video of his, and I was like, okay, I might want to subscribe to his channel. I go to his channel, and the picture of him is like 20 years old. I'm like, that's not the same guy. It's 20 years ago. So realize that we're now... You can try to do that, but in an age where there is so much information, I mean, just put in my name on the internet and watch what comes up. It's crazy because there's so much access to information. Now, you can try to control that. Good luck.
Right.
If you got a lot of money, you can pay people to control it. But the reality is you can't hide stuff anymore very well. So you might as well say, you know what, this is who I am. And if you carry that persona, people appreciate that now. And we're going to talk later about what that looks like. But the whole point here is just, if you'll just allow yourself to be real, that's a whole lot less work to wake up in the morning and say, you know what, I'm going to be the same person all day today that I am, whether I'm at work or at home or with friends or out in public. I'm just going to be the same person.
And that provides untold benefits, I suppose, right? As if you are changing to that and starting to do that more often at work, at home, and friendships and relationships, right?
Yeah, and realize there's two sides to this. So not only am I not going to be plastic when I'm out in public, I'm going to be real. You know, like see, it's real for me to show that my undershirt's a little different color than my shirt here.
Yes,
that's being authentic. See,
okay,
just pointing that out. That's
Thank you.
Out. But the thing is not only is it not about being plastic, it's also about saying, you know what, I also can't be abrasive in private. So we all have heard stories about somebody that seems to be a really nice person, and then they, you know, the CEO of the San Francisco Giants just got caught treating his wife horribly. He was shoving her and got caught on video doing it. And now he's had to resign or step down from his post because turns out he wasn't that same guy with his wife as he is the rest of the time. And people are like, oh, we can't tolerate that. So that's what I'm talking about, is being the same person. Both don't be too syrupy sweet on one end, but also you better watch it because everything you do now is being watched. So quit treating people poorly.
That's very true. All right. And easy to do, right? You can do that. You can start that now.
Just being real, yeah.
Okay. All right. Thank you for keeping it real, Dr. Hattabaugh.
All right.
We'll talk to you again next week.
See you then.
All right. That is Dr. Mike Hattabaugh. He is with us every Wednesday from the Encouragement Lab right here on KSJE Farmington. Wind advisory in effect until 6 p.m. tonight here in San Juan County, New Mexico. Outside our studios at San Juan College at the moment, the current temperature is 37 degrees. Winds are out of the west at 15 miles per hour. We have seen gusts as high as 39 miles per hour today. The forecast calls for a mix of rain and snow showers today with a high of only 41 degrees. Overnight tonight, isolated snow showers continuing with a low near 30. And then for tomorrow, partly sunny skies, the high 43 on Thursday, mostly sunny on Friday with a high of 47, overnight lows in the mid-20s tomorrow night to around freezing on Friday night. This is KSJE, Farmington, New Mexico, the information and cultural beacon of the Four Corners at San Juan College.